Hi everyone, this is Dr. Kaplan along with Veronica Oliveras, our
Hello.
nurse injector. And today we're going to be answering questions regarding Botox. And we'd also like to take this time to thank everybody for following us on Instagram and on YouTube. And we are blessed to have such amazing patients. Well, Botox, Dysport, Xemin, those are all neurotoxins. And basically, a neurotoxin is a muscle paralytic. It paralyzes the muscle. So Botox, contrary to most beliefs, it doesn't reduce wrinkles. What it does is it paralyzes muscles. Muscles, when we animate, will cause the skin to wrinkle. So if the muscle is not working, the skin will not wrinkle.
Well, we see patients as young as their early 20s coming in. I think that prevention is always important. Some people are like, oh, I'm too young to get Botox, which is not necessarily true because we have young patients who have a lot of wrinkles in this area and crow's feet. So I would say early 20s is acceptable.
Okay, so the facial muscles, well, first of all, Botox has other purposes besides facial muscles. A lot of neurologists and plastic surgeons will inject neck muscles, the trapezius muscle for clinical conditions such as torticollis and any kind of muscle spasm. If you inject in those areas, they will decrease the knots in your back or in your neck. But as far as facial rejuvenation goes, which is different than neurological indications, what we usually try to focus on is the corrugator muscle here and here. This is the procerus muscle here. This is the frontalis muscle here. So the frontalis muscle actually enables us to raise our eyebrows. When we contract the frontalis muscle, the eyebrows will come up. So this is actually a good muscle. If we knock this out with Botox, the eyebrows drop down. That's a common mistake that a lot of novice injectors make, is that they think that they should inject where the wrinkles are. So they inject a lot in the forehead and the eyebrows drop, and that's not good. So what we try to do is we actually try to inject the muscles that cause the eyebrows to depress or go down. So the muscles, when they contract, that bring the eyebrows down is the corrugator and the procerus, mainly the corrugator. When we contract these muscles, the eyebrows will go down. And so if you have very, very strong corrugator and procerus muscles, the frontalis muscle has to counteract that by wrinkling the forehead. And then you get what's called forehead rhytids or forehead wrinkles. So if we knock out these muscles that depress the eyebrows, the forehead muscle or the frontalis does not have to work overtime, and so you have less wrinkles. Other areas that we commonly inject, this is the orbicularis muscle. It's a sphincter muscle which will close the eye. If you contract the muscle, what you'll find is that the lateral aspect of the orbicularis will pull the lateral brow down. So sometimes what we do with Botox is we'll inject the lateral aspect of the orbicularis so that the lateral brow will raise. That's called a lateral brow lift. Another area of injection is the depressor anguli, which brings the corner of the mouth down. If you inject there, the corner of the mouth will go up. Some people don't like the way that they're frowning or that the corner of their mouth goes down. So if we inject this or knock it out, the corner of the mouth will go up. Some people have bruxism where they grind their teeth at night. So we inject the masseter muscle, which is one of the strongest muscles in the body per square foot. So if we inject the masseter muscle, this will also give less squareness to the face. Sometimes when people have a very strong masseter muscle, the jaw looks very square. So if you inject it, it'll soften up. Another muscle that we could inject, sometimes we actually inject the muscle down here under the nose. If we inject that, one of the results we'll get is that the tip of the nose sometimes raises a little bit. Another muscle here is the mentalis muscle. Some people complain that when they smile, their chin dimples too much, so we inject there as well. So there's a lot of indications for Botox. For facial rejuvenation, it's really, if you have a good understanding of the anatomy and you know what each muscle does, you could really reshape what the face and the function of the face.
Everybody's different, but we say anywhere between 4 to 6 months. We see our patients coming back. Some people can actually hold out a little longer, and some come closer to the 4 months. So I would say it's different for everybody, but you can expect between that time period, 4 to 6 months. You will not see the effects for probably 7 to 10 days before the muscle actually paralyzes and you can see like the smoothness, but you can resume normal activity except for keeping your head up for 4 hours after.
Yeah. Sometimes what we also find is that people that get Botox on a constant basis or a regular frequency, like every 3 months, that the Botox will actually kick in sooner. When you take a year off from getting a neurotoxin and then you come back to get injected, sometimes you're allowing that muscle to get stronger again. So then you'll need more Botox and it takes longer to kick in. So if you reverse that way of thinking, then the guidelines is to get injected every 3 months and follow that routine. This way it kicks in quicker and you're keeping the muscle weak, so you don't require as much Botox as you would need initially.
Okay guys, we're done for today.
And we hope you enjoyed our hologram experience. We're going to be changing the setting that we answer our questions in from week to week. Thank you.
Thank you.